Welcome back, Dr. Avinashi. Today's topic is how to keep our eyes healthy and fit despite aging.
Right. Yeah. Thank you for having me. It's good to be talking to you again.
Yeah, so how do we do that? How do we, as we age, we can't help it getting older, but our eyes, how can we, keep them as healthy as possible?
And that's a good question. I don't think there's a magic solution that I figured out in my professional career years. But just like we need to make the efforts to keep our body healthy, active, well nourished, properly nourished, we do the same thing with the eyes. So what benefits our body will obviously in turn benefit the eyes. Staying active, physically fit, making sure you're mindful of your diet, eating the right things, and cheating every now and then is not a bad thing. But what we do for our body repercusses in better health for many of the organs, including your eyes.
What about, are there some foods that
Yeah.
are like carrots, for example?
I'm not going to say no to that, but I'm not going to say that we should rely solely on carrots to be important for our vision. It's maybe a little bit of a wives' tale now. Vitamin A is very important to our eye health, of course, but most of us in the North American diet, we get enough vitamin A. But, you hear parents telling kids still, and my parents did the same, if you eat a lot of carrots, you won't need glasses. I don't know if that's true. I think, and I come back full circle to saying a well-balanced diet is what's most important. And ensure you have enough vegetables and fruits, antioxidants. Carbs are not a bad thing. We get scared of carbs, but it's a healthy thing and part of our diet. Now, certain foods that we do recommend when necessary. For example, when patients have high risk factors to macular degeneration, there's a lot of buzz about the word lutein, which is a carotenoid. And carotenoids are not something our body produces. It's something that we ingest, and that we're born with or that we ingest. And that carotenoid is important for the preservation of our macula, which is where our central vision is focused inside the eye. So it's not that meaning everybody needs to take high doses of lutein, which is found in green leafy vegetables, colorful vegetables like red peppers, yellow peppers, kale, squash, things of that nature. But if we know that you have either high risk factors, which may be you're a smoker, you're diabetic, you're above a certain age, you have family members with macular degeneration, you're female, or you're Caucasian, light-skinned, or you have light color irises, then you're at higher risk of developing macular degeneration. And that's when we would tell our patients that, hey, listen, we should look at some supplementations for carotenoids or lutein specifically, and we can either recommend stuffing. But in the meantime, for the general population, just eat a well-balanced diet that has a lot of those vegetables. And then there's a concept of antioxidants. Antioxidants found in blueberries and a lot of fruits are very important, and a lot of superfoods have that too, are very important to the general well-being of your body, avoiding excessive oxidative stress. And with the eyes, that's important as well. But is there something that everybody should be taking? Not necessarily again. As far as another supplement that I do talk about a lot with my patients is omega-3s. I do find there's benefits to omega-3s with certain patients. Now, again, we talk about details. It's not just any omega-3 and not just for every patient. Patients that suffer from certain levels of chronic dry eyes or ocular surface concerns, omega-3s can be a really strong additive to your approach to managing that dry eye. Because it's an anti-inflammatory, and inflammation deals heavily in the surface of the eye with patients with very dry eyes. And omega-3s are also, they help improve the quality of serum or secretions that's coming out of the eyes. So again, not just any omega-3, when you are consulting with your doctor of optometry, they can advise on which omega-3s, which formulations work most efficiently, and that can supplement your diet to properly address those concerns.
What age is it that you start? Is it in your 40s or
40 when you start
losing, becoming like your eyes are getting older?
That's a good question. Everybody wants to push that a decade later on in life, and I'm not old yet. There's different things of our eyes that age differently. So if we're talking about your vision, the most common thing that we talk about is the 40s, so that 40 landmark. Because when you hit that age, something called presbyopia starts. And presbyopia, in Latin translated, it means aging eye. It's when we start to lose the ability to focus in at things at near. So a loss of accommodation or focusing ability. And that typically starts in the early 40s. And so people think that is the biggest aging aspect of your eyes. But then you have elements like cataracts, which is often seen around that sixth decade of life, or 60 years old, or major eye diseases or leading cause of blindness like macular degeneration and glaucoma. That can we can see that at any age, but again, that 60, 65-year-old kind of benchmark is when we start to see the prevalence increase.
So it's best to see an eye doctor like yourself, like twice a year, once a year, or does it depend?
As much as I'd love to see many of my patients twice a year, I think we don't need to do that. We follow a old kind of saying, check yearly, see clearly. And especially for kids and seniors, so anybody below 18 and anybody above the age of 65, we highly encourage coming annually for your eye exam. If somebody's coming to see me at the age of 50 years old or 40 years old and they have very healthy eyes, minimal change, we will book them every 2 years. Now, if there's medical conditions that we're monitoring, be it macular degeneration or glaucoma or other ocular surface diseases, we may see these patients every 6 to 12 months.
So you get checked and you will have symptoms, right?
Yeah, for the most part, most ocular conditions have symptoms. But things like glaucoma, which is the second leading cause of blindness, is asymptomatic until it's advanced. So again, just coming in routinely, we can be on top of things and ensuring your ocular health and your visual well-being.
Thank you very much.
My pleasure.
I'd like you to come back.
Be more than happy to, anytime.